Good afternoon, everyone. Thank you for joining us. Why don't we get started? A little housekeeping first. I'm Kim Hines, and I'm the Outreach Coordinator at Access Health CT, and we're excited about this webinar. If you have any questions, please type them into the chat box, and at the end we'll read them and take care of those. If you have trouble with your audio via the computer, you can also call in. All right, let's go. So again, I'm Kim Hines, I'm your moderator. And we have Tam Ahmed, the Executive Director of All Payer Claims Database at Access Health Connecticut, to walk us through the overview of Access Health CT's Health Plan Selector tool. Thank you so much, Tam.
Thank you very much, Kim. Dumped with high out-of-pocket costs by buying plans unsuitable for their health condition. Hopes to change with information on total costs is current premium costs. So the total cost of enrollees, as I define total cost, is not only the premium or net premium, which is net of subsidy, but also how much they will have to pay. For example, if I go to a doctor, I may have to pay, depending upon my plan, some copay, or I may have to pay the full amount before I meet the deductibles, etc. So those are the kind of plan descriptions and plan characteristics that drives a significant portion of our out-of-pocket costs. They come typically from copays, from co-insurance, from deductibles. So we need to consider that as a very, very big part of the total cost of care. So beware if you are only using the net premium or premium to consider your choices. And this is the reason why we consumers understand about this tool. Like I said, the goal of this tool is to enable enrollees in the exchange with the following two broad objectives. Make their decision, personal consumer decision-making process. They will allow them to consider all type of costs under consideration before making informed decisions. Secondly, customize their future expected unique health condition, which metal tier they should be buying their plans from, given their income, their health condition, their all other characteristics of the household, whether the household comprises of only one member or multiple members. So they have to take into account all of their characteristics. And lastly, we created a tool that has to be very simple so that anyone can use it. It's typically self-driven with a lot of help in the tool, that there are lots of places where you can hover over the icons of question mark icons and help how you should be.
Bless you.
And unmuting.
There are two components that consumers ideally should bring to the table before making a choice. Which health plan should I buy? Which metal tier should I buy? Should I buy a bronze plan or a silver plan or a gold plan? So there are two sides in making the decision. One is, okay, in Fairfield County, and you can ages in the household, you can have a variety of health plans at your choice, and you say, okay, what is the rational way of a health plan? Of course, consumers, what they may do is that they may buy the cheapest one. And so what is the big deal about this plan? And we are saying, no, that's not what you should be doing. You are doing the blue part. Now let's talk about the red part. The red part is called expected medical utilization and cost, and I call it demand for health services. What it means is that if you would know about your family's health. You would know if your kid has asthma or your spouse has diabetes, and you may know a few things that maybe you're expecting, and the plan next year, that plan should be covering her delivery. So all of these things that you know about the family makes up that fact, along with the fact that you know about the disease, about the surgery, about the severity of your family's health conditions, drive the expected or future utilization of healthcare. And so bringing these two things together makes a much better choice that you can make using both sides of the information. I will show you things to how did we federal poverty line, which kind of drives the system. If your federal poverty line is above 138%, but it is low, it's low in the low under 400%, you are eligible for some kind of subsidy. We also make sure that we collect information, not collect information in the tool, use the information whether you are an American Indian or American Native, because those are the kind of subpopulations that have access to certain kind of plans. And then we ask for legal residency status. These are information we use in the tool. We do not collect it and save it. We just use it in the tool to determine, we run algorithm to determine whether you are eligible for an exchange plan or you are eligible for a Medicaid eligibility. QHP is the exchange plan, the commercial plan. So we also use, like I say, location, because every county has different rates. And then we estimate the second lowest silver plan in the county, et cetera, We determine what amount of subsidy you will get if you are below 400% in your family taxable income, and then whether you are eligible for cost savings reductions, which are certain types of silver plans that given a level of your 150 to 250% of a federal poverty line, you are eligible for certain kind of cost savings reduction plan. So those are the supply side. Those are given. Those are like basically very mechanical. Okay, these are formula driven and all those kind of things. But what is not so is the next slide, which shows you demand for health services. What is the demand for health services? So what we did, we used a large claims data in the Northeast region to identify people with chronic condition, chronic diseases, and multiple conditions, and also developed a list of common elective surgeries. By the way, this is not it's not a long list, but it is the most common list of things that can go that people seek their plans to pay for. And then we developed the cost and utilization benchmark. For example, if a kid has asthma, what will be likely be expense for the whole year? Asthma kid will have different kind of maybe ER visits and all kind of medications. So we would come up with a number like it's $2,500, $3,000 that will be likely be the total expense of going to doctors. Not that you will pay for it, but it is a total expense. If you did not have any insurance, that would be the amount that you would pay, of course, even more than that. And then we used age and gender specific benchmarks, because we know that sometimes age and gender bands drive the costs of various treatments. So if it is a male under 18 versus female under 18 or over 18, those are the kind of bands we created for benchmarking. Now let's talk about other items, which is, we also created in the tool, you will see that people, when they have a particular condition, especially disease like diabetes or cardiac disease or depression or others, they are likely to be in a range of severity. Some could have very bad asthma. They may end up in ER repeated times in the hospital, perhaps even. So we left some idea to determine how your household disease severity by members. So you would see low, medium, or high severity. And we gave you indications about what is a low for asthma or what is high for asthma. So typically giving an idea, if you have gone to your PCPs a few times a year for one of the members or yourself, you are most probably a low. But if you have ended up in ER and have had multiple specialist visits and all that, and some brand name drugs, you are most probably in a medium. But if you ended up in hospital and you have known that your kid goes to the hospital often and you are on in and out of ER and all those kind of things, then it's severe. So it is kind of subjective how you consider putting any member who has one or more conditions into one of the bands. And also it is quite prevalent that people who have one chronic condition may end up with more. So we also made sure, and having more than one, it makes it doubly or multiplicatively more severe. So we made sure that we capture the reality that people with diabetes oftentimes have hypertension and oftentimes have cardiac conditions. So we made sure that some people are like that, and we allowed the list to have comorbidity in diseases. And then we have developed multiple age bands and gender. We know the utilization also varies by multiple age bands and by whether they're male or female. And so we created this huge benchmark data for various types of age and gender bands, so that we can make the calculation much more accurate. And that's one of the biggest aspect of this health plan tool. Now, why am I going into more details? I just want to make sure I'm not giving you a lot of details, but somewhat pretty good level of details. The health plan selector tool, the way it uses the information that I have been telling you about, how we created a benchmark data and all that, is to be able to marry it with the item that is most important is the service, the detailed service utilization. For each plan, we have been able to identify 23 unique services. And this 23 unique services means a primary care physician visit is a service, a specialist visit is second service, a preventative care visit is a third service, a maternity care is a fourth service. And we have hospital, outpatient, pharmacy, ER, these are all unique services. And by the way, when you look at the benefit description of your plan, you will see that the plan provider has given you unique cost sharing information. For example, if you go to a primary care visit, you will have to pay $30, which we call copay. Or if you end up in ER, then you pay $200, right? So we make sure that we conform to this plan benefit literature for all the plans that comes and sold through the exchange. So we can make them on compare them on equal footing. So this plan has $200 ER deductible or copay, and this plan has $500. So we know which plan has what. So this is necessary because each plan, whether across different metal tiers or within a given metal tier, is a little different in various benefit structure. And these benefits are compared across these 23 types of services. They have also different by plans on deductibles and out-of-pocket max considerations as well. So these are like the plans that we compare across all the plans within metals and across the exchange. So we run the algorithm by these different plans in a way to implement these tools. As I was saying, some more details that the benchmark for each disease or surgery has been developed, and we have gender, as I say, age band 4 of those, severity of disease, there are 3 of those, by 23 medical and pharmacy line of services, and for each medical or pharmacy service, for each plan has specific set of information regarding cost of coverage like copay, coinsurance, deductibles, and max individual family. As you know, these out-of-pocket costs, which are copay, coinsurance, deductible, and maximum, they are much more generous when you have a gold plan versus a silver plan versus the bronze plan. In a bronze plan, you will see that the deductible is very high, the coinsurance is very high, so you will have to pay a lot upfront before you start getting the benefit. So this is the way of comparing across plans. Now, moving on to, I'm skipping a page and I'm going to this visual graph. In the past, what I have done here, given you a very simple visual comparative picture. In the past, we did not have the red lines. Okay, forget about the red lines. We did not. So if you were if you're a consumer and you were looking for service, you only looked at the blue segments only, not the red segments. So you're looking at net premium. Let's say your federal poverty line, FPL, is 250 or 300, and you could still get some subsidy from the government. And what you are going to do is look at the net premium, and which is the blue line. So you would say, hey, plan A and plan B both are bronze. If I have to choose a bronze plan, I most probably will buy the plan B. And if I were buying a silver plan, I will most probably buy the plan C. And if I were buying, why should I buy a gold? I mean, I could get the bronze or silver so much cheaper. Everybody is buying the silver, so let's pick up something silver. The question is, as you bring these two together, now you know through the tool what will be your out-of-pocket cost on the same basis, let's say per month. Then you can see that if you, lo and behold, if you bought plan B because it's a bronze plan, you could see that your out-of-pocket cost from this, you declared that, yes, my wife is going to be pregnant next, she's going to have a baby next year, and I most probably need a knee surgery, a bad knee, or my kid is going to have this or that, and you know that your out-of-pocket cost is going to be pretty high, although you didn't know before the tool that how high it could be. So you could see if you had bought a bronze plan, you would pay like $489, $500. Basically, you would have paid close to $6,000 in out-of-pocket costs for the whole year. So if you look now, all the plans, doesn't it look like that maybe your gold plan F would have been better for you? Initially, you would not have even thought about it. Why would I have bought a gold plan, which is most probably one of the high-end plans, $165 per month. But given that what you have in the future, that you could predict that you would have a knee surgery, then you would know that this would be the most optimal plan because you now see both of those out-of-pocket costs and your net premiums that we have. Okay, going over to this tool part. The tool is pretty simple. There is a disclaimer. The disclaimer simply says that, yeah, of course, we created a tool. We looked at lots of people's experience. I mean, we most probably looked at thousands and thousands of people with asthma and diabetes and all that. Still, we could go wrong, in projections. So we should not be held responsible, etc. That's the basic part. You accept and you move on to with the tool. And the tool uses a very simple set of, ask you a very simple set of questions that, what is your county? You most probably, chosen Hartford, and you have an applicant and member 1, 2, 3. Member 1 is typically the spouse and the rest are dependent. And you say, okay, I'm buying, applying for health coverage. Sometimes some people of the family of 4, you may not, but we know that this thing happens in reality. Not everybody is seeking. Your wife could be, or your spouse could be, could have a health plan, but its employers are not giving it to the rest of the family, right? In that case, but you still have to declare everybody. There's a tax implications because the FPL requires you disclose every member of the family before we, family as you did in your tax return, so that we can determine the accurate FPL, federal poverty line. Whether they are seeking for coverage or not, that's a completely different issue. If some member is not seeking coverage, say no, which is the drop-down box. And then a pregnancy or not, it's important. Pregnancy is important is because, you may not know, but sometimes a family where a spouse is pregnant may be even eligible for Medicaid program, which has very low cost, zero cost, and no deductibles and all that. So it is important. And also FPL, the federal poverty line, gets lowered because a pregnant woman is considered 2 people, not 1. So that's why you need to know whether a person in your family seeking coverage is pregnant or not. And then we have to enter your expected income next year and whether you are Alaskan tribe or not. If you said yes, we could have also carried on with the estimation, but the likelihood of somebody being that is very low because the population is very low. So I'm giving you general, kind of an example. And then there's the immigration information, right? Remember, this is a tool, but it tells you what kind of, if you are a legal and lawful resident, or if not, they will also ask for that question. It's a very simple set of questions. We are just simply to make sure that you are eligible for, because if you do not have a legal residency for some member, then it will stop. The tool will not count them in the final estimates. They will give you an estimate, but excluding that person in the family. Now, we determined that in this family, with such an income, it is quite possible that you may end up with only one person being eligible for QHP, because the rest of the family, given that income 65,000 and the person's spouse is pregnant, most probably what happened, all of the members got covered like Medicaid, and you are the only person, the applicant is the only person who is being covered by QHP. So, am I mixing it up? No, yeah. I think there is a.
You want to skip the one with the Fairfield?
Yeah, I think.
Okay.
Yeah, I'm sorry. I had an extra page there. I don't know how it came. So.
Okay. We'll go to the next one.
Okay, we go to the next month for this person who has a family of 4 people with age 42, 36, 5, and 3. Now it will determine. The tool will determine now, given the income that has been reported at 65,000, who would be eligible for QHP, qualified health plans, through the exchange, and those who would be, like I said, I predicted that what happened is that all of the other members are now AHCT covered, so they will fall out of estimates anymore because their coverage costs 0 basically. So only applicant age 42 will now be carried forward on the next page. On the next page, you can see member 1 is eligible for Medicaid. Member 2, age 5, is eligible for AHCT B. Member 3, age 3, eligible for. So this algorithm, this tool has algorithm that will split the population if the age and other attributes are in the right order between Medicaid and QHP. Now, let's say if the woman was not pregnant, then most probably member 1 would have become QHP, right? But she's pregnant, and a higher FPL is given as a bar for her to become part of the AHCT. Then we would have 2 people, applicant age 2 and member 1 age 36, to fill out a few things here that is not generally done elsewhere, which is we needed to know the gender. The reason is I said it in the past that we created these benchmarks based on gender and age bands, right? So age we knew all along, but we just want to know if it is a male or female, because their patterns in diseases or surgery is a little different. So, and then we asked for their condition. Like I say, this person may have multiple conditions like diabetes and rheumatoid arthritis, and the member is not planning any surgery, and the condition is severity is low. If you look at those black with the question mark inside, those are the places where if you go over with the mouse, you will see that explanation of what is a condition severity is and how will you determine it is low, medium, or high, and same time all those kind of the helps that you get. Now, moving on to the next page, you can see this is a prelude to the last page, which what we are trying to say is that, you know, your total medical cost that would be shared by health plans and you is $6,840. But if you did not have insurance, your total medical cost would be $15,000, and you would be responsible for all of it. So what is the benefit of this insurance? We were trying to tell the members that if you, what is the benefit of having insurance, basically, and giving you some numbers, quantifying these numbers, that with insurance, with your condition, people don't understand that, but diseases cost a lot of money. And if this person needed a surgery, the cost would have been so much higher. Now, once you go to the next page, you will see, firstly, do you want to be quoted a monthly or a yearly expense? Most people want monthly because yearly is difficult. But remember, even if you choose monthly and your premiums are done monthly basis, your cost that you incur, right, may not be monthly, but I'm splitting it up across the whole year. But remember that if you go for a surgery, it's not like you have to pay for the whole year, although you can try it out with an arrangement with your provider, with the hospital, that, hey, I can only pay at a monthly basis. So we split it up at a monthly basis so you can understand what is the implications of. So if you look at the bronze, silver, and gold plans, you will see that given your condition and your family, 3 of them are already in Husky, your cost at the bronze plan is between $788 and $912. The silver plan, $682 to $988, and gold plan, $664 to $860. These are the different choices. Now, if I am rational or something, I would simply go with the first one, which is the gold, because the low end of the gold plan, I mean, that's low. I mean, it's compared to all other plans that I see, is the lowest to start with. So I will go to the gold plan, and if you look at the gold plan, you can sort them out by total cost column, and you say, voila, I got this Anthem Gold HMO Pathway X Enhanced Multi-State Plan. That would be the appropriate one, because although its premium or net premium is $449.63, but my out-of-pocket cost per month is $195. So when you combine these two, is $664.63 is the lowest one of all of it, right? So you can now select that this is the lowest plan that I can go with, and then you go and click on the plan. Let's say you have chosen the Anthem plan, you like it, and you can click on it, and you see those information, all kind of information for this plan, and you can delve down into it and look at the benefits. You can even look at you can have linkages through these various overviews, right, to see if your physician is a network or not. You can find those information from these various links, and that's the way we figured that you would be able to make the right choice about a plan.
Thank you, Dr. Ahmed. Oh, that was wonderful. Really fascinating. So I am quite sure people have some questions, so just type them into the chat box. Right now, I'm just going to take a couple minutes to talk about partnering with Access Health Connecticut. You probably have seen this before, but if not, we'll go through it. So what does it mean to be a community partner with Access Health Connecticut? So partners share information about access to health coverage with their communities and their clients all over Connecticut. Access Health provides the resources and invites dialogue with our partners. And so we try to provide all the information that could possibly be helpful to folks that are enrolling. So our community partners are a wide variety of organizations, from community health centers to faith organizations, library, hospital, Department of Labor, all kinds of organizations join with us. So over this past year, we've developed a new community partners website, which I think is really, really helpful. The address is learn.accesshealthct.com/community, and there's all kinds of resources on here. For example, we'll have our events, trainings, and speaking requests. If you want to invite us to an event, you can do that. There's a form for that. Also, there's all kinds of stuff you can print out for your community members. Anything from immigration status and getting health care, to tax penalty, to the COBRA flyer. There's all manner of stuff on here. As you can see, there's some examples of the flyers that are on there. We have a monthly community newsletter that we send out that has all kinds of information about what's going on in the state, as well as on the ACA in general. And finally, there's contact information, and sometimes people have different problems and aren't quite sure who they should call. Should you call myself, your moderator? Should you call a broker? Should you call someone who is in charge of working with CACs? So anyway, that is all on here. So we would love it if you invited us to your events, because we need to get the word out. We need folks to enroll. We need people to get health insurance. And the way we do that is by being everywhere we can in all different sorts of communities and just raising awareness and getting people to know Access Health Connecticut. So if you want to book us for a speaking engagement or a tabling at an event, you can email me at outreach@accesshealthct.com or fill out the form on the community partner website. So here's some information. I'm going to leave this screen up for a while, just so you can write stuff down if you need to. As well, this whole webinar will be available shortly on the community partner website after we're done here. So, I do have a question that has just come in. Dr. Ahmed, what is the level of accuracy of the tool in estimating the enrollee's actual out-of-pocket costs?
Thank you for asking that question. I have looked into, there are 8 or 9 other exchanges that have the tool, but they have not. What I found out that what I've looked at their website and their details on the tools is that they have not been able to, first of all, figure out which disease that they're talking about, what kind of hospitalization they're talking about. They're just simply saying it's low, medium, high. But low, medium, high of what? A low of asthma is pretty simple compared to a low in rheumatoid arthritis. So there are different diseases and there are different trajectories and different levels of expenses that needs to be done to even maintain that condition. So what we have done is basically very specific about what kind of conditions we are talking about, what kind of surgeries we are talking about, and whether we are looking at the data at different age band level, at a gender level. So, and we also, having the 23 discrete services that we analyze all of our data with makes our tool pretty much a very accurate kind of a tool that we are very proud of, that is much better than the rest of the industry.
So what about pharmacy costs? Is that included in the tool's estimate?
Yes, the pharmacy cost is included, but that's the only weakness in our tool is not letting the enrollees choose the exact pharmacy. There are few states that allow it. We did not want to make a tool that forces the people to make all kind of decisions. So we wanted the tool to be simple, but if the consumers want that the pharmacy be included explicitly, then we can have another screen there which allows the members or the applicants to choose the right pharmacy. But even then, it is not done so directly. We have included the pharmacy cost in the background. The reason is this: when we looked at the asthma patients' care, we looked at their pharmacy costs along with medical cost. And although you wouldn't see what kind of drugs your households, your children are using, let's say, but in the benchmark, we have included that cost of the pharmacy, but you will not be able to see it and not be able to control it. I understand that makes it a little bit less accurate, but the solution is a much more complex one. And if the enrollees want it in the future, we can have a direct pharmacy choice there. But it is included indirectly.
And so another question came in: what percentage of consumers are using the tool? Is that something we know?
Yeah, we have been tracking the use of this tool. We feel that for the people who are buying the new health, there are 2 types of people that are in the exchange. One type is retention, those who have bought the plans in the past before the tool was rolled out, and then there are new people who are coming to the market. We know that over 50% of the new people coming in use the tool, and we hope that this will increase even more in the future.
Because everyone on here is going to talk it up, I'm sure. Yeah. Let's see, I think we have time for one more question. So does the tool take into account APTC or cash savings reduction credit?
Yes, there are two different ways of doing it. The APTC is a direct subsidy. It simply depends upon the FPL of a household. The CSR is not a cash handout. CSR is limited to having a more generous plan variant in our exchange. The CSR is only applicable for silver plans. There are 6 types of silver plans: a standard, then followed by 2 plans which are for American Indian, Alaskan Native. They're called zero cost or limited cost. Then silver plan with 70% actual value, 87%. The next one is 87% actual value, and the last one 94% actual value. Right? So these are different types of plans. So if a person with FPL of 151 or 2%, that person has access to the 6 silver plan, which is 94% AV, right? Our tool recognizes it and then runs the person's household's utilization through that plan's 23 types of discrete services, and most of the cost is very, very low. Their deductible and co-insurance are low, and most of those are like co-pays, and so yes, you will end up having a very low out-of-pocket cost. So yes, this tool does include both of those.
That's great. So I think let's call for any last questions. No? Well, I want to thank all of you for taking the time out and joining us. And I want to thank Dr. Tam Ahmed for coming and explaining all this kind of complicated. I don't think the tool is complicated in and of itself, but the background is a little bit complicated. And now, at least for me, it's much clearer. So I really appreciate that. So thank you, and everyone have a good rest of December.